Hi, everybody. Thank you so much to TCME for doing this webinar and for inviting me to be part of it. Thank you, Jan, for starting us out with that beautiful meditation. I love getting to start a presentation with the meditation first. I needed to make sure that happens in the future. And it's quite an honor for me to be here with Jan, who's my teacher, and with Claudia, my new friend and colleague. I did want to just say one thing, which is that I'm at home here in Seattle, and I have a very big dog. And so I can't predict if he's going to bark sometime during my presentation. So apologies in advance if he does, but I think he will be good. Hopefully he'll be good. So I'm going to speak today about the work that I do, childhood obesity, and focus specifically on mindfulness of connection. So in the work that I do, I wanted to share a few facts that some of you may know about obesity already, and to some of you this may be new. So the Center for Disease Control, the CDC, has predicted that the children who are living right now are the first generation of children who will not live as long as their parents' lifetimes. That is, their lifespan will be shorter than their parents. They're also predicting that 1 out of every 2 minority children will develop type 2 diabetes in their lifetime because of our obesity epidemic. And as you all know, the obesity rates that we're looking at here in our country and other countries are a result of a myriad of cultural forces and changes that have happened over the last several decades in our food systems, in our lifestyles, in many, many different factors. And to me, our behaviors are very much impacted by our environment and our culture. And I think as a pediatrician, someone who takes care of children, I think that's particularly notable. I also work in a community clinic in the inner city of Seattle. And while our city doesn't have as much impoverishment as there are in other perhaps East Coast cities or other cities across the world, many of the children that I take care of are burdened by things related to poverty, such as living in neighborhoods with less parks and open space, grocery stores that don't have as much fruits and vegetables available, fresh fruits and vegetables, neighborhoods where it's not safe to walk outside, and schools that are less resourced and less high quality. And then the parents that I work with really share so much of their stress with me in clinic. And some of the things they're dealing with include homelessness, partners who are incarcerated, family members who are incarcerated, not being able to find a job, food insecurity. And we know that this kind of chronic stress is associated with both increased sedentary activity and increased caloric intake. So not only are these children in environments where they have less ability to have healthy food, stress. So when I think about obesity as a whole, I think a lot of people in our society still see it as an issue of individual choice. But for me, in working with these families, I very much see it as an issue of environment. So for me, something was missing in how we're taking care of families around obesity. And when I stumbled upon mindful eating, I thought that this was perhaps a really important missing piece of the puzzle in what we're doing traditionally in obesity care. And I think particularly mindful connection is a very important component of this, mindfulness. So what do I mean by mindful connections? For me, mindful connection means conscious and intentional linking and building of relationships among organizations, schools, workplaces, daycares, entities like clubs, neighborhoods, families, and individuals. So Michelle mentioned that I was going to talk about the socio-ecologic model of health, and this is an illustration of this model. It looks like an onion. And this model is used in public health as a framework for understanding the broad factors that influence an individual's health and wellness. are called the social determinants of health. So if you start in the center, we'll go from micro to macro. We start in the center with the individual, and each individual has their knowledge, their attitudes, their skills, and mindfulness might be one of those skills. And then you move out to the interpersonal level where we have relationships with our family, our friends, and other social networks. You broaden out yet another layer to our schools, workplaces, churches, religious organizations, and then another layer out into our community, which includes our neighborhoods, our cities, the layout of our environment where we live, and then to the broadest layer, which is public policy, so national laws and regulations that influence so many myriad of things that then trickle back down to the individual. The Institute of Medicine has published several books to address obesity in our country here in the US. And in their most recent report on obesity, which was in 2012, this was a sentence that they wrote in there, which I felt really spoke to this issue of connection. So from their report, they said, there is an urgent need to employ large-scale transformative approaches focused on multi-level environmental and policy changes within interconnected systems to reduce the threat of obesity and sustain an enduring impact. Lots of big words in that report. So moving from government speak to my speak, for me, what this report was saying is that we really need to look at connections at all levels. So reconnecting us to our food sources, looking at whole and local foods, reconnecting health to academics and learning in schools, reconnecting families. I think that our lives are so fast-paced these days that we're losing the relationship between parents and their children in the shuffle of work. And so we need to reconnect as families. And then reconnecting ourselves to our bodies, and that can be reconnecting children to their own bodies and even ourselves as adults. So I'm going to go back through the socio-ecologic model and just go through each of these levels and give just a very small example of how to connect at each level. I'm going to work from outside in. So at the very largest level of policy, one way to be connected is to be engaged. And in the issue Food for Thought that we got to write in, I gave an example of a policy that at a federal level that has really trickled down to our children in the schools. So many decades ago, when obesity was not so much a problem in the United States, but hunger was, our federal government decided to subsidize the production of corn and to help farmers in producing more corn for our country. And so corn and wheat and soy were all subsidized, and we began to produce large amounts of all of these crops. And now times have changed, decades later, and these policies haven't changed, and yet we have a surplus of corn, which has now been made into high fructose corn syrup, and corn is ubiquitous in so many of the foods that we eat right now. And often these surplus foods then go towards what our children get in schools. So you can see the effect of a policy made many decades ago that trickles down to now and trickles down both from a governmental level down to our children. And so I think our awareness of these broad policies affecting us as individuals is important. And then certainly if this is something you're passionate about, you can get more engaged in advocacy. I think one benefit of being a healthcare provider, either a physician, dietitian, nurse, is that we have direct contact with families and we have stories. And legislators always want to make things personal, and our personal stories are very useful. So in our state, we have an organization called the Childhood Obesity Prevention Coalition, and it's made up of many organizations that help advocate for policies that impact obesity both at a local and a state level. But I think professional organizations are doing the same kind of advocacy. So if you're a pediatrician, the American Academy of Pediatrics, or if you're a dietitian, the American Dietetic Association, many of these professional organizations are passionate about childhood obesity prevention and doing lots of work in that realm. Building community. So getting connected with other people and organizations in your own life and seeing how you can impact them in bringing mindfulness to eating and activity. So your children's soccer team, you can think about what kind of snacks are being brought to your child's sports activity. I know many baseball games, soccer games often have snack shacks associated with them, and you can talk to people around you about what kind of food you want to be serving at these activities. Helping your neighborhood improve a playground, helping your local school develop a garden. These are all small examples of ways to bring mindfulness to eating and activity in your own life, in your own community. There's many projects happening all over the country now that are funded by foundations such as Robert Wood Johnson Foundation or through our government from the Affordable Care Act. And there are many cities and jurisdictions across the country that have been granted money to try to improve healthy eating and active living in their communities by doing this kind of work and building communities. So you can get involved in those kinds of things as well. Activating schools. What would it look like if schools were a sense of health and wellness for children? When I thought about that today, it actually sort of made me chuckle, just to think about the schools right now and whether I would consider them centers of health and wellness for children. I think we have some room to grow in that. I think the connection between health and learning really needs to be brought to the fore, and I think that we're all in a position to be able to help make that message heard by people in academic institutions. Healthy children learn better, and children who are eating healthy foods and children who are moving and active in their bodies are going to learn better. And so the more we can advocate for this in schools, the better. This can be advocating for getting vending machines out of your local school, or helping your school develop what's called a walking school bus. Walking school buses are an active way for kids to get to school. Basically, you organize a chain of families walking to school together. And from the furthest point from the school, one family comes and picks up another family, picks up another family, picks up another kid, and then they all walk to school together. That's called a walking school bus. There's a wonderful organization called Action for Healthy Kids that's doing lots of work around improving healthy eating and activity in schools. And then moving on to families. And I want to talk a little bit about the feeding relationship. I was at work a couple months ago, and the dietitian that I worked with came in the room and shared with all of us, our team, a story, a scenario that she shares with many of her families to describe what's important about the feeding relationship. And so she brought us all back to thinking about a newborn and having a cradled newborn in your arms, or thinking about a newborn in their mom's arms. When a baby is being held and cradled, the baby feels enveloped, held, secure, and loved. And in this environment of security, attention, and love, a baby can drink milk and have the capacity to follow her innate hunger and fullness cues. And this is a beautiful thing that all babies are born with, this ability to eat when they're hungry and to stop when they're full. What's beautiful about this image is that when a child feels secure, they can pay attention to their bodies. And it reminds me that the relationship between the parent, the mother and the child, or the father and the child, and the environment, how secure the child feels, really impacts their ability to tune into their own body, into themselves. This is really easy to picture in your own mind if you just imagine a stressful meal with a child. So many of the children that I see are coming in because their parents are worried about their weight. And so many times they talk about that mealtime is the most stressful time for all of them. And often these children are eating and they can feel their parents' eyes sort of looking at them, watching every single bite that they take. And if you imagine that situation, possibly pay attention to their body when they are in a very stressful situation. In contrast, think about a very nourishing meal that you've had recently. And often what I think about is eating out with my friends. There's lots of conversation, you're in a comfortable place, everything's very open, there's a lot of joy and connection, and the food just tastes better. And so you can contrast those two scenarios for how important the environment and the relationships impact how we eat. So as I was fortunate enough to take Jan's mindful eating course and learn more about mindful eating, in the midst of doing this childhood obesity work, I really felt like I was finding a missing link or starting to see a shift in my own view on how to approach this issue. And to illustrate that for you, I thought I'd share with you what some of the parents say who I see. So often parents come in and these are their complaints about their children. He just eats and eats and eats. There's no off button. She asks for food all day long. Our meal times are so stressful. There is so much tension. We don't let her have any more. Even if she says she's still hungry, we have to control her eating. You can hear in these parents' words that their response to the fear of their child becoming obese is often what they know, which is in our culture, food restriction. Eat less bad food. So it can be certain foods, amounts of foods, denying children's hunger cues. And you know, our drive to eat is so innate, particularly when there's scarcity. It's just ingrained in us as animals. So when we can't eat or when we don't have access to food, what happens? I want to put in here is that whenever I work with parents, what I have is that I always work with families with an underlying belief that they are doing the best they can. And it may be lack of knowledge. It may be that they're making parenting choices based on how they were parented, or making choices based on their own upbringing or history with food or eating. They might have not had enough food when they were young or grown up in poverty or in hunger. I think it's incredibly important to recognize the diversity of experiences that our parents come to us with and to be open to hearing their background in order to better understand why they're making the choices they are with their children. The other thing I think is important in teaching parents is just some basic things about child development. So when children are very young, probably between the ages of 1 and 4, one of the key things that they are doing is developing self-regulation around eating, sleep, pooping and peeing, elimination, and emotions, understanding what emotions are, what they feel like in their bodies. And then for all of these realms, how to manage these issues. And often the children that I see who are coming in with obesity at a very young age often have dysregulation in many of these areas. The other thing I see that I try to share with parents is just the change in growth over time. And for those of you dietitians who work with, toddlers, infants and toddlers and children, you know that the infant eats ravenously. Their growth is so huge in that first year of life, and then it really slows down in the toddler years, and toddlers become more picky, their growth slows, and their body mass index hits a nadir around the ages of 4 and 5. And so I think normalizing these changes in eating is very important for parents, for them to understand that the child's growth is changing, and so their eating patterns will change, and to normalize what parents are observing. I wrote in my article, we must learn to trust the natural growth and development of children and strike a balance between giving them the foundation that they need without interfering with our own agendas or fears. And as a parent myself, I know this quite intimately, to try not to interfere with my own agendas or fears. It's a very challenging thing to do. So just to summarize, I started to notice a paradigm shift for myself in my work in childhood obesity from the things in the left-hand column towards the things on the right-hand column. So I think focus is very disconnected from emotion. We're very focused on numbers, how many calories in, how many calories did you burn, and this whole process is extremely anxiety-provoking and stressful for families. There's also a huge focus on what's wrong and not what's right. I think with mindful eating and focusing on mindfulness and connection, we can move this field, my field, your field, to looking at families' health, well-being, and peace of mind. I think it's important to look at it as a process and not that there's a goal or an endpoint. I think it's incredibly important to connect the mind and the body. And I think in the work with children and as they grow, one thing we need to empower our parents with is a sense of trust. Definitely, I think this approach would decrease anxiety and stress for everybody, parents and children alike. And it allows us to focus on what is present. This is a slide, just a picture that I found that I really love. What if your problems are not really problems or barriers, but actually pathways? I sometimes think of obesity as a symptom. It's just a symptom of a bigger issue. And so what are the bigger issues? And can we help support families around these bigger issues? And then for me, the tenets of mindful eating include the wisdom of the body, that our body knows what we need to eat and how much, and that eating is connection, connection with the earth, connection with others, and connection with oneself. And I'll end here with a quote from Mother Teresa: "The hunger for love is much more difficult to remove than the hunger for bread." Thank you so much, and I'm going to pass this over to Jan.
Great. Thank you so much, Lenna. It was lovely. I'm going to, let's see, Jan the presenter. And Jan will be sharing her screen in just a second here. That'll come up. And she'll be speaking to us about obesity and how to help kids